Today, on our channel Pediatric Case Review, we're delving into the world of intussusception, a topic that's essential for healthcare professionals and parents alike to grasp. Join me as we explore real-life cases, ask critical questions, and uncover the key aspects of this condition that can impact our young patients. A 2-year-old child presents with severe colicky abdominal pain, vomiting, and lethargy. On examination, a sausage-shaped mass is palpable in the right upper quadrant. What is the most likely diagnosis? A. Gastroenteritis. B. Appendicitis. C. Intussusception. D. Inguinal hernia. Correct answer. C. The classic presentation of severe abdominal pain, vomiting, lethargy, and a palpable sausage-shaped mass is highly suggestive of intussusception. A 9-month-old infant presents with severe abdominal pain that comes and goes, vomiting, and episodes of lethargy. On examination, the child appears well between episodes but has pallor. During an episode, a palpable mass is noted in the right upper quadrant. What is the most likely diagnosis? A. Gastroenteritis. B. Appendicitis. C. Intussusception. D. Hernia. Correct answer. C. The classic symptoms of severe abdominal pain, vomiting, and a palpable mass in a child between 2 months and 2 years of age strongly suggest intussusception. A 4-month-old infant presents with irritability, intermittent episodes of inconsolable crying, and drawing up of legs towards the abdomen. On examination, there is no palpable mass. What condition should be considered? A. Colic. B. Intussusception. C. Teasing. D. Constipation. Correct answer. B. While the symptoms can be non-specific, the drawing up of legs and irritability may be seen in infants with intussusception, even in the absence of a palpable mass. A 5-year-old child with a history of recent abdominal surgery presents with abdominal pain, vomiting, and fever. On examination, there is tenderness and guarding in the lower abdomen. What should be considered as a potential cause of these symptoms? A. Postoperative ileus. B. Intussusception. C. Incisional hernia. D. Constipation. Correct answer. B. Intussusception is not common in a 5-year-old child, but in a child with a history of recent abdominal surgery and symptoms like abdominal pain, vomiting, and fever, intussusception should be considered as it can occur postoperatively. An 18-month-old child is brought to the emergency department with abdominal pain and vomiting. There is no palpable abdominal mass, but abdominal distension is noted. The child appears to be in pain. Which diagnostic imaging modality should be considered as the initial investigation? A. Abdominal X-ray. B. Contrast gas enema. C. Ultrasound scan. D. CT scan. Correct answer. C. In the absence of a palpable mass, an ultrasound scan is the preferred initial diagnostic imaging modality for intussusception. A 10-month-old infant presents with episodes of vomiting, diarrhea, and lethargy. On examination, there is no palpable mass, but the child appears pale. What additional risk factor should be investigated? A. Recent rotavirus vaccination. B. Recent travel history. C. Family history of gastroenteritis. D. Exposure to a pet dog. Correct answer. And in a child with vomiting, diarrhea, and pallor, considering recent rotavirus vaccination as a risk factor for intussusception is important. A 6-month-old infant presents with blood-streaked stools and intermittent abdominal pain. On examination, there is no palpable mass, but the child appears to be in distress. What is the next appropriate step in the management of this patient? A. Perform a rectal examination. B. Administer intranasal fentanyl for pain relief. C. Consult a pediatric surgeon. D. Discharge the child with reassurance. Correct answer. In cases of suspected intussusception with blood-streaked stools and abdominal pain, a rectal examination may help assess for any evidence of red currant jelly-like stools. A 1-year-old child presents with blood in the stools and abdominal pain. On examination, there is no palpable mass, but the child appears uncomfortable. What should be the next step in the evaluation of this patient? A. Order a complete blood count CBC. B. Perform an abdominal X-ray. C. Consult a pediatric surgeon. D. Administer intravenous antibiotics. Correct answer. B. In a child with blood in the stools and abdominal pain, an abdominal X-ray can help assess for signs of intussusception, such as bowel gas patterns. A 7-month-old infant presents with intermittent abdominal pain, vomiting, and lethargy. On examination, there is no palpable mass, but the child appears unwell. What is the initial step in management? A. Start IV antibiotics. B. Administer IV fluids and analgesia. C. Perform a rectal examination. D. Consult a pediatric gastroenterologist. Correct answer. B. In an unwell infant with symptoms of intussusception, the initial step is to stabilize the child with IV fluids and analgesia. A 4-year-old child presents with recurrent abdominal pain, diarrhea, and occasional blood in the stools. On examination, there is tenderness in the lower abdomen, but no palpable mass is felt. What condition should be considered as a potential cause of these symptoms? A. Irritable bowel syndrome. B. Intussusception. C. Crohn's disease. D. Gastroenteritis. A 3-year-old child presents with vomiting, diarrhea, and abdominal pain. There is no palpable mass. What is the most likely diagnosis? A. Appendicitis. B. Constipation. C. Gastroenteritis. D. Intussusception. Correct answer. C. The combination of vomiting, diarrhea, and abdominal pain in the absence of a palpable mass is characteristic of gastroenteritis. A 7-year-old child complains of abdominal pain, primarily localized to the right lower quadrant. There is no palpable mass. What condition should be considered? A. Gastroenteritis. B. Appendicitis. C. Constipation. D. Intussusception. Correct answer. B. The right lower quadrant pain in the absence of a palpable mass is suggestive of appendicitis, especially in this age group. A 5-year-old child presents with recurrent abdominal discomfort and difficulty passing stools. There is palpable mass in left lower quadrant. What is the likely diagnosis? A. Appendicitis. B. Constipation. C. Gastroenteritis. D. Intussusception. Correct answer. B. Constipation can cause abdominal discomfort and difficulty passing stools and may involve a palpable mass in left lower quadrant. A 2-year-old child experiences recurrent abdominal pain and passes bright red blood in the stools. What conditions should be considered? A. Hirschsprung's disease. B. Gastroenteritis. C. Meckel's diverticulum. D. Intussusception. Correct answer. C. Recurrent abdominal pain and the presence of bright red blood in the stools may raise suspicion for Meckel's diverticulum. A newborn presents with abdominal distension and failure to pass meconium within the first 48 hours of life. What congenital condition should be considered? A. Volvulus. B. Hirschsprung's disease. C. Meckel's diverticulum. D. Intussusception. Correct answer. B. Hirschsprung's disease can present with abdominal distension and delayed passage of meconium in newborns. A 6-year-old child complains of sudden and severe abdominal pain accompanied by vomiting. On examination, there is abdominal distension. What condition should be suspected? A. Constipation. B. Gastroenteritis. C. Volvulus. D. Intussusception. Correct answer. C. Sudden and severe abdominal pain with vomiting and abdominal distension may indicate intestinal volvulus, which is a differential diagnosis for intussusception. A 9-year-old child presents with abdominal pain and a purpuric rash on the lower extremities. What systemic vasculitis should be considered? A. Kawasaki disease. B. Juvenile idiopathic arthritis. D. Intussusception. Correct answer. CHSP is a vasculitis that can cause abdominal pain and a purpuric rash, especially on the lower extremities. An otherwise healthy 10-year-old child experiences recurrent episodes of abdominal pain with no identifiable organic cause. What condition should be considered? A. Irritable bowel syndrome (IBS). B. Functional abdominal pain. C. Gastroesophageal reflux disease (GERD). D. Intussusception. Correct answer. B. Functional abdominal pain is a diagnosis of exclusion and may be considered when a child experiences recurrent abdominal pain without an identifiable organic cause. A 2-month-old infant has a noticeable bulge in the groin area, which becomes more prominent when the child cries. What condition should be suspected? A. Hydrocele. B. Inguinal hernia. C. Umbilical hernia. D. Intussusception. Correct answer. B. An inguinal hernia in infants can present as a noticeable bulge in the groin, particularly during crying or straining. It may not be a common differential for intussusception, but it should be considered in cases with a groin bulge. Thank you for joining me today on Pediatric Case Review. I hope you found this lecture on intussusception informative and valuable. If you did, please don't forget to like, share, and subscribe to our channel. Your support allows us to continue providing essential insights into pediatric medicine. If you have any questions or topics you'd like us to cover in future videos, please leave them in the comments below. Until next time, remember, knowledge is the key to providing the best care for our young patients. Stay informed, stay compassionate, and keep making a difference in the world of pediatrics.